Hi, my name is Christy Schwartz, and I own Crimson Consulting. Crimson Consulting provides compassionate, quality, and comprehensive behavior therapy services to children with developmental disabilities to promote socially significant skills that allows children with disability diagnosis to become more independent living individuals, increase functional communication, social interaction, and individualized play skills, as well as academic support to improve our children's quality of life for independent living across settings and people. We help educate and support the families and friends of these children in a caring, open, and collaborative environment. Our philosophy at Crimson Consulting is that we provide intensive treatment with the most effective research based therapy to make lasting changes in the lives of our clients. We believe that this is not one individual that can make change occur, but rather a total team approach to ensure that our clients are able to access the most appropriate services to meet their individual needs. Crimson Consulting strives to provide the highest quality services for children with disabilities. The emphasis is always client achievement and maximizing the individual's potential in the home, school, and community to create lasting change throughout their life. Crimson Consulting provides intensive home programs to children with varied developmental disabilities. Services are provided in a one-on-one setting in the child's home. In-home programs emphasize early intervention, behavior management, social skills, verbal behavior, and adaptive living skills. Parents and caregivers are an intricate part of the program and receive training to implement the programs independently. An array of services are offered to meet the individual needs of each child. One size does not fit all, and each program is tailored specifically to the child and their needs. Each treatment plan varies, but common goals amongst children are social skills, verbal behavior, family interactions, daily living skills, independence, and academics. Crimson Consulting intends to be a growing business that hires therapists that meet high standards, deliver service with integrity, have the ability to build relationships with clients, and ensure every family receives the attention they deserve. Our quality ABA therapy services require direct supervision with board-certified behavior analysts, and therapists are dedicated to the highest quality, which consist of board-certified behavior analysts and registered behavior technicians. With the rise in children being diagnosed with disabilities, the demand for ABA therapy has increased. Many times, families are placed on waiting lists for 9 to 12 months before providers can begin in-home therapy with a qualified therapist. 9 months without specific behavioral support is a long time to wait at the crucial time for intervention in a child's life. There is a demand for qualified ABA therapists in the Chicagoland area, and Crimson Consulting offers the finest. So what is ABA therapy? ABA therapy is applied behavior analysis. It's a science in which procedures are derived from the principles of behavior are systematically applied to improve socially significant behavior to a meaningful degree and to demonstrate experimentally that the procedure employed was responsible for the improvement of the behavior. ABA therapy tends to work with children with that have been diagnosed on the autism spectrum disorder, Down syndrome, developmental delays, oppositional defiant disorders, and other disabilities. Services are provided in the home, in the client's home. It also includes after-school programs, private schools, community, and other social groups that children participate in. So what services does Crimson Consulting provide? First off, we have an individualized programming and development. Each child is unique, and therefore we believe it is our job to design a behavior intervention program that is individualized to each child's specific needs. We continually assess each child's needs and use Crimson Consulting's intensive research-based curriculum to create a specialized program for each child. Our highly skilled staff are trained in a wide range of ABA methods to provide many options to find the intervention that works best to meet your child's specific needs. We use functional communication training. FCT is used to teach and establish replacement behaviors for inappropriate or harmful behaviors such as aggression or escape, noncompliance. When a child is regularly engaging in disruptive, challenging behaviors, the child is having difficulty communicating or meeting their wants and needs. Even for a verbal child, but particularly for a nonverbal child, Behavior is a way of communicating. It is our role to develop a comprehensive ABA program to replace challenging behaviors with more effective and efficient positive functional behaviors in order to get their needs and wants met in a more socially acceptable manner. We also offer social skills training. Social skills training, the focus of the program is to increase the child's overall ability to recognize and interpret verbal and nonverbal communication, develop appropriate peer relations, assist individuals with improvement in social interaction by expanding their interest in age-appropriate topics, toys, and play skills, increase their ability to recognize other emotions. The goal is to minimize the stress and anxiety when participating in social interactions. The program strives to provide the tools necessary for successful interpretation of social and communication skills. We also offer functional behavior assessment, FBA. FBA is the primary tool used to identify and attempt to understand a child's behavior. It is a multidisciplinary approach that incorporates a number of techniques, sources, or information and strategies to understand the reasons behind problem behavior and develop strategies or interventions to address the problem behaviors. The process involves documenting the antecedent, which comes before the behavior itself, and the consequence, what happens after the behavior. Over a number of weeks, interviewing teachers, parents, and others who work with the child, and manipulating the environment to see if a way can be found to prevent the behavior. This information is important because it leads the observer beyond the symptom, which is the behavior, to the student's underlying motivation to escape, avoid, or get something, which is at the root to all behavior. We also provide behavior interventions plans. Behavior intervention plans are developed from a functional behavioral assessment, and the BIP increases the accusation that the use of the new alternative skills decrease the problem behavior and facilitate general improvements in the quality of life of the individual, his or her family, and the members of the support team. ABA is widely recognized as a safe and effective treatment for autism and has been endorsed by a number of state and federal agencies, including the U.S. Surgeon General. Over the last decade, the nation has seen a particularly dramatic increase in the use of ABA to help people with autism live happily and productive lives. In particular, ABA principles and techniques can foster basic skills such as looking, listening, and imitating, as well as complex skills such as reading, conversing, and understanding another person's perspective. At Crimson Consulting, we strive to build that with families and make a difference in children's lives. There's 5 phases to our programming. The first phase is just contacting. The initial contact with the client. We meet, we discuss the problem, we explore the problem, we determine if Crimson Consulting is the right fit for the family, and then we discuss expectations of Crimson Consulting and the family. The next phase, if we continue on with our partnership, we do some data collection and diagnosis. We do assessments are conducted, data is gathered, and we try to define the problem as a team. After we have identified the problem, we enter the feedback and the decision to act. And that is findings are reported from the second phase of data collection and diagnosis. Goals are set for the individual, interventions are determined, and goals are set with short-term objectives. Once we have our intervention, we start our implementation. Services are provided on an ongoing basis. We progress monitor on a regular basis to constantly keep our finger on the pulse. We then enter the 5th phase, which is the follow-up. We evaluate the progress that's made. We determine what is working and what needs to change. We evaluate goals and short-term objectives. We also discuss the progress. We determine the next steps and what interventions and goals we would like to include. So as you can see, this is a whole team approach. It involves the Crimson Consulting, the family, caregivers, and the client themselves. Crimson Consulting strives to build relationships with families and make a difference in the life of a child. If you want lasting changes in your child's life or have further questions, please reach out to Crimson Consulting to discuss the change that you have been waiting for. Thank you for your time.